Good afternoon, sir. My name is Nurse Kevin. I'm going to be administering your morphine today. Would you go ahead and verify your name and date of birth for me?
Yeah, sure. Name Jason Bourne. Date of birth is January 25th, 1990.
Thank you very much. So I'm going to be putting on my PPE before I take a look at that IV. The purpose of today is I'm going to be doing an IV push on you. So the first syringe is going to be a saline solution. We're going to use that to make sure that the IV connection to your veins is still unclear of any debris or any blood clots. So it just establishes that we can get the medication into your bloodstream. The second one will be the medication itself. And the third one will be, once again, a saline to push the rest of the medication that may be left in the tube into your bloodstream. So, first I'm going to take a look at this IV that I did earlier today. Okay, this IV is looking good. There's no infection in place, no swelling around the entry point. Everything looks good with that. Okay. Before I draw this medication out, would you go ahead and verify your name and date of birth for me?
Yes, Jason Bourne, January 25th, 1990.
Thank you. And I'm going to be scanning your patient bracelet. Okay, everything checks out. I'm going to be removing this cap here and wiping this down with an antimicrobial wipe. This is to make sure there's no bacteria around the point of entry. Okay. So now I have my 3 syringes here. This first one is going to be the saline solution. So I'm going to take this, hold that like this. I'm going to put this in here, slowly pushing in. Okay, now that's good. I'm going to do a positive blood. So I'm going to pull this back a little bit. Pull out a little blood. Okay, that looks good. Perfect. So the blood flow looks good. Looks like we're ready for this 2 milliliters of morphine. So we're going to be putting this morphine in over the period. It's 2 milliliters, so it needs to be put in over the period of about 1.5 minutes. So just bear with me. I'm going to be putting it in every 15 seconds and pausing. And I'm going to be watching this clock very carefully to see exactly how much we're putting in at what time. Just to make sure that things are put in evenly and the way things are being distributed the way they need to be. Okay, so I'm going to cramp this line here. This is to make sure that the morphine doesn't flow back up into our IV tube up top. So this is just to keep the pressure. And when I start entering this in, I'm going to let go of this and it's all going to flow into your bloodstream. So go ahead and connect this line here. Great. Okay. Slowly start the medication. Okay, the medication's entering your bloodstream. That looks good. Watching the clock. Okay, got that good. All right. Next, I'm going to be using this saline. And this is just to push, like I said, the rest of the medication. Make sure everything is clear of the tube and into your body.
All right.
The way it is supposed to be. So, entering in. Feels a little funny, doesn't it?
Yes, it does.
But nothing too itchy or any issues going on with this IV. That's good. That's good.
Fine.
Okay. Got that in there. Looks great. I'm just gonna need you to verify that you're feeling okay and that the medication is not feeling weird? Are you feeling good? You
No,
don't need anything?
I feel fine so far. Yes.
Okay, good to hear it. So that was an IV push. For those of you that are watching at home, take very careful consideration with the steps that I use. The way things go is the way that it should be done.
Thank you, Nurse Kevin.